And our Vidant Spotlight this morning, we've got another one of the interesting people that work in our community at our world-class healthcare organization, Vidant Health. We're very fortunate to have it. And this is going to be an interesting conversation because I'm not quite sure what this person does, but we're going to find out. Her name is Dr. Julie Oehlerst. It is spelled Oehlert, but it's pronounced Oehlerst. And Dr. Oehlerst is the Chief Experience Officer for Vidant Health. Good morning and welcome, Dr. Julie Oehlerst. Thank you for coming.
Good morning, everybody.
Good to see you.
Very good.
And I can already tell that, with your personality, being the head experience officer, that probably fits your personality.
Best job ever.
How are you? It's nice to meet you.
Yes, it's very good to meet you. Thanks for having me.
Yeah, absolutely. Well, we love Vidant Health, and we love what it means for our community and for the region and the betterment of livability here and healthcare and that kind of thing. But also for the economic benefit that we have. But I have to tell you, I've never heard of a Chief Experiences Officer. So tell us what you do.
Yeah, so I'm strategically responsible for patient experiences and team member experiences and environmental experiences and equity and inclusion. And it's a fairly new role in healthcare, and I think that Vidant has been thoughtful and brave to have this role. There's about 150 of us maybe in the country, but really shining a spotlight on the experiences people have with healthcare. And I just think that it's a role that's very needed, and I think that Vidant has been innovative to say, hey, we want to focus on our patients and on our team members and on the environment that they either work or get care in.
Now, do you work throughout the system, throughout
Yes.
all the different hospitals in the system?
Yes, absolutely. So I am over all of Vidant Health. So I'm in the clinics and in all the hospitals. I go out in the region. The experiences of our patients in the region are just as important as the experience that people have here at Vidant Medical Center.
Does this? I always hate to say this because every experience I've ever had with Vidant, and my mother was in there in Vidant Medical for 10 days with pneumonia before Christmas, 90 years old, great experience. I have a very close friend who's over there right now getting ready to have heart surgery. I'm going to be going over there this morning. But I just find that we have world-class people delivering world-class health care. But I'm sure you get to hear all the complaints. Is that a big part of what you do?
Well, I get to hear the complaints, but I get to hear feedback of what we could do better, and I get to hear the positives. And I think if any company, and this isn't just healthcare, isn't actively working on engaging their workforce and their experiences, I think they're going to get behind because I just think every company needs to focus on that. And I think Vidant wants to be in that space. I mean, we want to be premier for experiences just as we do for our technology, our quality, and our safety. We want people to say, wow, I really felt like I was loved and cared for there.
And I'll tell you that's the feeling that I have had when I've had family members in there. Luckily, I haven't been in there recently and don't want to go back in there except to visit. So this is kind of a new thing in healthcare, and not every healthcare system. You said there's only like 150 of.
Yeah, there's not very many.
So how did you migrate to this position?
So I'm an emergency room trauma nurse by trade. So I'm a nurse, and I became very interested in patient experience and team engagement and physician experience and how that all mattered. So if the team members aren't having a great day and the physicians don't have the things they need, that does impact our patients. And so I became very interested in that. And I went back to school and I got a doctorate in leadership and innovation and studied design thinking, which healthcare doesn't always use, but I think that's really important.
Design thinking.
How
this
you
is very
design.
Deep.
I know how you design.
What is design
the
thinking? I've never heard of that one.
I know,
before.
right? How you design the healthcare experience. And I started kind of seeing this field develop. And so a lot of organizations they either focus on just the patients, or maybe they do a little with team engagement or with physician experience, but they haven't bundled it together to say all of this matters. All of it matters, how the the nurses and doctors and food service workers are treated matters just as much because it reflects to the patients. And that's what we did. Vidant said all of the experience of everyone on our campus matters. And so we are innovative in this space.
Yeah.
But I think some of the bigger healthcare organizations you have chief experience officers. Cleveland Clinic has one. A lot of them I know in the industry. But who doesn't deserve a better healthcare experience than the patients and families of Eastern North Carolina?
Yeah. I agree.
Really.
I agree with that.
Really.
Yeah, because we have a lot of illness here,
and we have a lot of people who struggle with their health, and they deserve the very best experience.
Right. Exactly. This is kind of a nouveau kind of approach, isn't it? I mean, it's really kind of interesting to see Vidant kind of step out and be one of the first in the country on this.
Yeah, it's I think it makes people feel that we're working on the right stuff.
Yeah.
When people hear that we have a chief experience officer that kind of works in harmony with our great quality and our great safety, and they're like, well, that's really balanced. That makes sense. And also, we want to be the best for the communities.
So tell me, what's your day like? What do you do on a day-to-day basis?
I get to come here and talk to you.
Not this day, any other day.
So I work with our Human Resources Department, and we have a great Chief Human Resources Officer on how we onboard and attract talent. I work with our Organizational Development Department on things like how do we engage our workforce, how do we innovate our workforce, because our workforce can tell us what we can do better, but they need a venue to do that, so I work with them. I'm out a lot, so I go over to the hospitals, I go out into the region, I work with the presidents on looking at patient experiences. I also do a lot with data. So I'll look at our social media, all of our social media. I look at our patient complaints.
I bet you learn a lot there.
I think the social media data is rich. I mean, some people
it's
don't like it.
definitely rich.
Some people don't like it. I love it because the patients tell us, Vidant.
Yeah.
Are you paying attention? And so I just love that.
So sometimes, and most of the time, that's just a forum for people to bitch. Excuse my French, but so you're telling me that you guys are actually reading that stuff and acting on it. Yeah,
absolutely. Because in that frustration is a lesson.
Yeah.
Did we not listen? Did we not explain good enough? Did we not include the family? What is that lesson in there? Mm-hmm. And really listening to our patients, even if it appears extreme, there's usually a lesson to be had. Or when they call us on the phone, we listen. And what did we miss? What could we do better?
Interesting.
That's the only way we're going to get better is listen to our patients.
That is really interesting that you monitor social media now.
Oh, my goodness.
See, most people monitor it but don't admit they monitor it. That's the difference. You guys are saying you're monitoring and you're actually doing something about what you're
reading. But we
read
it and learn from it. Yeah. And so we reach out to the patients. We've sometimes called them and said, whoa, we did not mean this. What can we do better? And all the patient complaints that come in, and even the compliments, we not only listen to them and deal with them individually, but I also trend them. What are the trends I'm seeing? Are we not communicating well in a certain unit? Mm-hmm. And then we try to work on that. We're not there, but we now actively, intentionally work on things like communicating with patients, their experiences, how they flow through the organization, what's a hassle for them. I always look at hassle points. If you have to wait too long at this desk, or you have to, those are hassle points. Mm-hmm. Sick patients don't want hassle points. They want it easy.
Yeah. Yeah, you're dealing with people at one of their worst moments.
Isn't that the truth?
And you're having to deal with they're probably not really objective at that a lot of times.
Yeah. Well,
so I can imagine some of the comments that you get.
Well, and I always say that the stakes are higher for hospitality and service in healthcare than anywhere else. Because if you go to like a business, or I'm going to say Disney because they're the iconic experience, you're healthy, you're happy. The stakes are so much higher in healthcare.
Right.
If you're coming into our cancer center, the stakes are higher for you to need to have a good experience. Because if you have a bad experience and also have been diagnosed with cancer, that's a memory that we'll never get over and you'll never get over.
Yeah, exactly. Exactly. My family's been through some of that the last few years, so I know what you're talking about.
We're pretty excited about our new cancer center.
Yeah, and the new cancer center, we're hearing we might be like 6 weeks away, something like that.
Yeah, we're very excited.
Brian Floyd was on with us on Friday morning over at the Give Kids a Smile event, and he hinted that we may soon have a ribbon cutting for the new cancer center.
Yeah.
And I was saying yesterday on the air about what we've seen in terms of taking care of patients who have heart problems, what that heart center has meant to Eastern North Carolina. And, I grew up in Eastern North Carolina. So, I mean, when anyone got cancer, you had to go to Chapel Hill or Duke. And our Eastern North Carolina people deserve better than that. We should.
I agree.
If you got to be treated for cancer, you shouldn't have to drive. I mean, look, where I grew up, you had to drive 4 hours.
Yeah.
Back in the day. And so, this is going to be fantastic to have a world-class cancer center here as well. And to quote Brian Floyd, it's going to be one of the best facilities in the country.
Yeah. Yeah, and I think that goes for all of our regional services, and that's one of the things that really attracted me to Eastern North Carolina is that we like to keep our services to our patients. A patient shouldn't have to leave their family to have care, and so we like to keep our services in the region. Here, we want our patients to know that they can get great care here and they can be able to drive home and be with their family, because the support of a family when you're sick is really important, and that philosophy really attracted me here.
Yeah. Where'd you come from?
Before this, I worked in California at UC San Diego.
Wow.
Yeah, so I came
from coast to coast.
Coast to coast. And before that, I worked in Tucson, Arizona. And both times.
Were you with Waldron out there?
I was with Dr. Mike there.
Yeah.
Philosophically, I totally love working with him. He believes in kind of what I call the big experience.
Yeah.
Everyone's experience
Right,
matters.
yeah.
And
for folks who don't know, Dr. Mike Waldron, who is now the CEO of Vidant Health, came to us from the University of Arizona system in Tucson.
Yeah. And I had this role, and then I had an operational role as well.
Yeah.
And so when I knew that he was here, it didn't take me long to kind of fall in love with Eastern North Carolina.
Yeah.
You come here and it's beautiful, but it's so heartfelt. And so I thought, what a better place to work on experience than here.
Yeah. I recently had a chance to introduce Dr. Waldron at an event last week, actually, and I made the comment that he was the perfect person to lead Vidant at the perfect time. Because, it seems like we have everything in this community kind of moving in the same direction for the first time. University's working with Vidant, Vidant's working with the university. And I mean, let's be honest, it just hasn't always been that way. But you've got great leadership now at both places.
Yeah.
And there's a lot of synergy that can be achieved when we have our two big elephants in this community moving in the same direction, and I see that happening right now, which I think is fantastic.
You can always count on Dr. Waldron to do what's right for patient and families.
Yeah.
I mean, he is just a very caring leader, but always very focused on patient care. I mean, he's a physician by trade, but that is very attractive to me to come here and work with the kind of leaders, and Brian Floyd and the other presidents, to work with leaders who care so much about patients.
Yeah,
it just is great for me. I mean, it just makes me feel very useful here.
We've had great leadership here over the years, and we've got it now. We've got very good.
I agree.
I love Brian Floyd and Dr. Mike Waldron.
I agree.
Well, it's great meeting you. Anything else that I haven't asked you that you want to mention about? Again, if you're just joining us, this is Dr. Julie Oehlerst. She is the Chief Experience Officer for Vidant Health. This has been interesting.
I just want to say that that's something that we're very focused on, and that we love feedback, and we want people to give us feedback of how we can be better. We don't want people to not tell us. I love the feedback, and that this is an initiative for us that's very meaningful, because we want everyone to say, wherever they are, oh my gosh, not only was it great quality care, safe care, but at Vidant, they really care about me and my family.
Yeah. Well, that's great. And we appreciate you coming by and being on with us.
Well, thanks for having me. I appreciate you asking me.
It's good to see you.
Oh,
and
thank
we'll
you.
have you back.
Thank
you. A lot
you.
of fun.